Hello and welcome to this video, which is about documenting a prenatal visit if you are a medical student working at the Family Care Center. And like with the other videos we've done in this series, we see that there's a patient on the schedule today, and her name is Mrs. OBGYN Test. I will open her chart by clicking on her and clicking on Open Chart, and this takes me to her summary where you can see her problems, her medications and allergies and that sort of thing. And let's just assume for the purpose of today that this is a follow-up OB visit early in the pregnancy. So to open her office visit from today, we will double click on the office visit, and that takes us to the note, and we will go right into looking at the vital signs. And first, just notice that the vitals are slightly different from the other vitals forms in that in addition to the height and weight and blood pressure, there's a place here for the weight change. And so you can see that her pre-pregnant weight was listed as 218 pounds, and her weight today is actually 217 pounds. So you can click her calculate total weight change for the pregnancy and her weight change since the last visit, which in this case turns out to be the same number of -1. Early in the pregnancy, it is not unusual for someone to lose 1 or 2 pounds. Now, the questions that the nurses ask are also somewhat different during a prenatal visit, and you can see here that they've asked about swelling and cramping and vaginal bleeding and smoking, and this particular patient is a smoker. Now, by clicking on Next Form, that brings us to the point of care testing form, and you can see that the nurses have already done a urinalysis. They will usually do that for any prenatal patient, and this particular patient has a perfectly normal study, and so we can skip past that on to the next form, which in this case is the Add Form Suite for OB visits. This looks like the form that exists in the Well Child Check note, where you can add different components to your note by clicking on these different buttons. You don't actually have to spend much time on this form in this particular note because most of the forms you need for a prenatal visit are already there. So we'll click on Next Form to get to this, which is a very useful form. This is the education prompt form for patient education around pregnancy, and there's a lot of patient education that has to happen during pregnancy. And you can see on the left that there are boxes that have already been checked, and those are topics that have been covered by a prior provider at a prior visit. And if you check off anything today, it will stay checked so that the next doctor who sees the patient, or if it's you again later on, will know what things haven't been covered. And as a medical student or a resident, you often don't know exactly what to say about a given topic. And so if you want to know what to say about seatbelts, you click here and some information will appear on the screen that you can then share with the patient. You can even just have the patient read it aloud with you. And then once you've covered seatbelts, you then check the box here saying that you've covered that. And that's true for any of these topics. There's good information on a variety of topics, so you can give appropriate counseling to patients, even if you're relatively new to prenatal care. Lastly, with this form, I'll just point out that there are tabs for the first trimester education prompts and similarly for the second and third trimester. And so if you're seeing a patient later on, you should move forward to the correct trimester so that you can find appropriate education for that patient. And that brings me to the next and final form for the prenatal visit, which is called the MCH-OB exam form. And this is a form that has multiple tabs, including ones that fall off the screen to the right, and I'll show you how to find those. And the first tab you come to is just a general summary that includes the patient's prenatal labs listed over on the right. And so you can see that this person has a blood type of A positive and a negative antibody screen and was negative for RPR, but the rubella screen was positive, suggesting she's immune, and so on and so forth. And it's good to review these things every time you see a prenatal patient just to make sure that there's not something that stands out. The one thing that stands out in her particular case is that she has a positive urine culture, and so we will need to make sure that she gets adequate treatment for that if she hasn't already. So to get to the next tab, you just click on the word dating here. So this takes me to the next form, which is a very important one that you understand, which is the dating form. So you can see here that the person's last menstrual period was entered as September 11th, 2013, and the EDD based on that is June 18th, 2014. This person's also had a prior ultrasound that's been entered, and that was done on 11/4/2013, and it was done at 8 weeks and 2 days on the basis of the ultrasound, and that gives an LMP of 6/14/2014. And then that raises the question, which of these two dates should we use for the EDD? Well, if you're uncertain, printed up above in green are the guidelines for when to change someone's due date on the basis of the first ultrasound. And in this particular case, we find that the ultrasound agrees with the LMP, and so we go with the LMP as the due date. And someone has already confirmed that the EDD should be used as 6/18/2014. And so to figure out the person's gestational age today, you click on Calculate here, and you see that the person is 9 weeks, 0.71. And just be aware that this is done in decimal points, not in days of the week. 0.71 is equivalent to 5/7, which means this person really is 9 weeks and 5 days. Okay, so moving on to the next form. This next form has to do with prenatal genetic screening, and I won't spend a lot of time here because the resident or the attending will be mostly the one to fill this out, and I'm going to skip ahead to the OB follow-up history. Now, the history for a prenatal patient is often very brief. We ask that you ask this set list of questions. Does the patient experience fetal movement, contractions, vaginal bleeding, fluid leakage, or edema? And some of these have pre-populated from the nursing notes, but you should always reconfirm them because sometimes patients don't say things to the nurses and change their story when they're talking to the provider. There's also a set of questions around alcohol and smoking and drug use, which you should fill in. And then there's a free text box here in case the person has a separate complaint. So let's say she's complaining of nausea or a rash or something, you could type that in here. Now, moving forward to the next tab, once you're done with the history, that leads us to the exam. And again, for a prenatal visit, the physical exam is often extremely brief. You might only be doing the fetal heart tones, the presentation, and the uterine size. If the person has a particular complaint, say a rash, you might document something under skin exam here. But for a typical well prenatal visit, often all you have to do is say, okay, we listened to the heart tones, but we didn't hear them, not heard early pregnancy, because at 9 weeks you often wouldn't. Presentation for this, you might also again say early pregnancy. There you can see there's options for breech or vertex or transverse for later in the pregnancy. And the uterine size, again, if you're not doing a bimanual exam, you can't assess that at this particular visit, but let's say you did and you found that the person was 10 weeks. You could say that. And then, like with other forms, there's a chance just for free text if there's particular physical exam things that you did that don't appear on any of the drop-down menus. Now, you'll see that we've made it to the right-hand tab at the top of the screen, but there's a little arrow here, and that indicates that there are more tabs to the right. So if I click on this, you'll see more appear, and I'm going to click it several times to get a few to show up. So the next tab is the OB flow sheet, and this just gives you a graphic chance to see the person's urinalyses and prior blood pressures and weights, and that sometimes is useful. For many visits, you don't really need to spend much time here, but it's often helpful to see things in a graphical format. The next form is a listing of the past pregnancies, and here you can see the prior pregnancy that was where she delivered in 2011, and that it was a vaginal delivery, and she had a 7-pound, 2-ounce baby girl, and that there was a complication, that she had a postpartum hemorrhage. You can click on there to read the full thing. Moving on, the next tab is for the birth plan. Again, you don't have to fill this out at every single visit. Often that's done gradually over the course of the pregnancy, but you can see that previously that people have entered that this will be a vaginal delivery, and that she's expecting to do an epidural, and that she's enrolled in childbirth classes, and that her husband's going to be her coach, and so on and so forth. The last form to know about is the assessment and plan form, which is similar to other assessment and plan forms, except it has one important difference. In addition to the usual assessment and plan boxes here, there's a separate box above it for the OB plan. And this is a box that contains notes from the last visit, and anything you enter in here will be preserved for the next provider. And this is a place where we keep a running list of issues in the pregnancy that need to be followed up over time. And the fact that it populates from the prior visit helps us keep track of things over the course of a pregnancy. And so you can see here they've entered that this person is a smoker and is contemplative and should be counseled at every visit. And let's say today she's decided to quit. We could change that and say has decided to quit. And then that will be there for the next provider as well. And you can see that she will need a Tdap later in the third trimester, and that we could change eventually when she does get her Tdap. We could indicate that she's had that done. Now, under the problems down below, I always assess pregnancy as one of the things. Let's say today we're referring her for her nuchal translucency ultrasound, which is part of her genetics testing for Downs, and prenatal education done today. And that just indicates that you did talk to her about certain topics. And then if you also dealt with her allergic rhinitis, you could say refilled, her Flonase, that sort of thing. And those then don't reappear every single visit. But it's important to keep track of both these linear things in the OB plan up above, and then the little things that happen on a day-to-day basis, like you would do for a normal office visit. And that is it for the prenatal visit. It is a more complicated looking form, but often the documentation for a prenatal visit is actually quite a bit easier and briefer. Good luck with this as you go. And you can always watch this video again during the course of the rotation if you can't remember how to do this. Thanks.